Hi everyone, this is Amy at Page Penguin. Super simple sites for doctors. Make your site in minutes, no programming required. At Page Penguin, we believe simple is smart. And do you ever wonder where all the good dentists went? Well, I'm with one here today. He's the kind of dentist you remember when you were a kid. The kind of dentist you really trust. So we're here today with Will Hahn, Dr. William Hahn of Tribeca Dental Design. And in my opinion, he is the best dentist in New York City and certainly the best dentist in Tribeca. So, Will, thanks for coming. And how are you?
Good, good.
Good. So, can you tell me how long you've been in practice?
This location about 4 years,
Okay.
and doing this for about 8 years.
Nice.
And
Okay. And maybe tell us your address so we know where to find you.
144 Chambers Street, New York. New York.
And
in
very,
Tribeca.
very close to the 2-3 stop.
Right.
Chambers. And so tell us, how did you get into dentistry?
Well, first I thought, good lifestyle, interacting with people and helping people out here and there. And I guess growing up without a dental insurance, I thought, you know what, maybe I can make a little bit of difference. And I definitely didn't get into it for the money.
Yeah.
I would have definitely gone into banking if I wanted to make money, but I mean, it's definitely a rewarding field, and it's fun also.
Okay.
Keeps your day go by really fast.
How many patients would you see in a day on average?
Between 30 and 40.
Okay, quite a few.
I mean, that's including a hygienist seeing patients, and we have also another dentist here, so that's total number.
Okay.
So each of us see about 10 people a day.
Nice.
So
That's good. That's a good ratio. It seems like that would give you enough time to actually give each patient, individual attention,
Right,
let them talk to you.
Exactly.
So.
Exactly.
So what's your general philosophy about dentistry, if you could?
Listen to people, what their needs are, and not just give them my opinion, but see what their needs are. That's my main philosophy, and don't push anything, don't try to sell anything, and give them what you would do for your family or your friends.
I
And
like
yeah, that's just pretty simple. And I didn't want it to be like a factory or typical dental office when you walk in, and I don't want it to be intimidating experience or or a lot of the times when I went to dentist when I was little, it was you kind of always walk out feeling guilty or feeling pretty bad about yourself. So something a little different than that. So I want it to be more enjoyable experience.
Excellent. And what sorts of services do you offer here?
Pretty much everything.
Yeah.
I mean, if we can't provide certain service, then we usually refer them out to a right specialist.
Okay.
Just giving them the right direction, where to go.
So you do teeth whitening here, you
Yes.
do the cosmetic things.
To general dentists, to even seeing little kids as well.
Oh wow, you see children as well.
Yes.
Okay, I didn't know. How young?
I mean, today we saw a little kid who was a year and a half, just to get them used to coming to the dental office.
Yeah.
It's not for treatment, just checking to make sure they're doing right thing and developing right habits.
Okay.
So
That's great. So what if someone came to you and they were kind of borderline needing a cavity, not needing a cavity? What would you do?
I usually wait.
Do you?
I usually wait. It also makes people feel more comfortable. It makes me feel more comfortable too, because in the beginning of the cavity, we can actually scrape them out and we can actually give them a little fluoride, and sometimes it stabilizes and sometimes it actually goes away. But sometimes it develops into something a little bit bigger. So at least when we work on them, even if we wait, at least patient feels more comfortable that way too. So.
Wow, and you do endodontics here as well?
Yes.
Wow.
Unless they're complicated, then we refer them out. Simple ones, yes.
Okay. And just with local anesthetic?
Right,
okay.
right.
Excellent. And how would you describe my experience of coming to you being different than my experience of going to another dentist in the area?
First of all, I just don't want people to be confused, and I just want to explain everything that needs to be done or that things that don't need to be done. I just like to sit there and explain to them what their options are instead of saying this is it and you have no other choice. I like to give them options and choices before we go on to anything. And you know, even also for a lot of people, finances are really important, so give them the options. And you know, it's not just my way or highway, it's usually what patient feels more comfortable with.
Okay.
So
that's great. And can you tell me about your staff?
Our staffs are all pretty eager people. I try not to, you know, randomly pick anybody from the street. We don't put help wanted sign in the front. Usually they're all, a lot of them are just recent college grads or people who's been in this field for a long time and who have love for this field or who wants to go into this field and we're eager to learn. So when you talk to our staff, they're really friendly and they're going to go out of their way to help you. So.
Excellent. Okay. And do you mind if we take a tour of your office?
No? Good.
Okay. So this is the entryway, or the waiting room.
It's pretty simple waiting room, so.
Yeah, but you have the Eames chairs, which is nice.
And we have a modern art piece, so people who know stop by and look at it. It's a panoramic x-ray that takes pictures of your whole mouth. And so just taking 25 x-rays, we try to minimize that by taking this x-ray as well too. Well, this is the treatment room.
Okay.
All the chairs are up now, but we have a TV in each chair so you can actually watch TV and get your mind off of things. And x-ray in each room, and these are pretty new modern chairs and they're pretty comfortable, and we try to make it as calm and comfortable as possible with the lighting and everything. So other than that, it's just
Great. Well, congratulations.
Thank you.
And thanks for talking to us today.
No problem, anytime.
All right.